Okay, we're going to jump into it. I'd like to welcome everybody back today to Alabama Care. We have the pleasure of being with Mr. Antwain Jordan. Mr. Jordan here is a single father, special needs child, and today we're going to be talking about his journey and recently moving to Alabama and what that looks like. Mr. Jordan, if you would introduce yourself.
Well, as Mr. Bun said, my name is Antwain Jordan. I recently moved to Alabama about a little over a year ago from Georgia with my son Mateos. And it was a pretty interesting experience. It's a lot moving a special needs child, just making sure that you were able to get and coordinated with the doctors and just kind of making that transplant, and it's kind of scary in the beginning, but like once you get to the process, it's really reassuring to know that as you just even start getting that ball rolling, there's so many other people out there that actually want to help you make sure that you successfully transfer. So that was the really great thing. Like once I got that ball rolling, it became less scary and just more of just making sure I do all the required things.
How did you start to get that ball rolling?
I worked and focused on like his primary doctors that he really that really encompass his disorder. So Mateos has an unknown genetic disorder that causes him to suffer from like epilepsy, and due to the epilepsy, he's had a lot of regression in regards to being able to like move and breathe. So I made sure to touch bases with his neurologist first and his pulmonologist, because those are the two most important care providers in regards to just making sure that he maintains, quality of life every day, making sure his seizures are under control and making sure his breathing's under control. And the social workers between those two specialty doctors really connected me with all of the other much needed doctors like physical therapy, occupational therapy, and everything else afterwards.
Yeah, so you kind of went to the doctors first there as the professionals, and said this is, I assume during that move, you're really focused on the medical needs of your child first and foremost.
Of course.
You have to make sure that that's going to be congruent across that transition.
Exactly.
So it makes sense to go there. I kind of want to take a step back real quick. So you're originally from Georgia.
Yes. So I'm from Georgia. I was actually born in Miami, raised in Georgia my whole entire life. And I stayed in a small little town called Woodstock, about 45 minutes outside of Atlanta. But it was, I loved it there. But I moved closer to Alabama to be closer to my daughter, whom I also have as well. So I'm a single father of 2 kids.
Okay, very good. Miami. I've heard there's kind of everybody's leaving San Francisco right now, and they're going to 2 places. They're going to San Antonio, or Austin, and they're going to Miami.
Pretty much, yeah. Miami's kind of like the west of the east.
Yeah.
Definitely.
So I've heard businesses are leaving there and they're going to Miami. I've only been through Miami one time, but it was beautiful.
Oh, it's absolutely amazing. I unfortunately don't get a chance to speak with my family as much as I would like to down there in the Miami area, just because, with everything that's kind of going on. Being a busy parent with father especially, and then just being a busy parent in general of 2 kids.
Yeah.
But one day I plan on going back down there here soon within the next few years and let my kids be able to enjoy that wonderful weather that's down there in Miami. So.
Yeah. And I'm sure Corona is not helping that. I haven't seen some family in Pennsylvania for like a year, and I usually see them once or twice a year at least. So
wow.
It's kind of been hard,
Mm-hmm.
I don't think we talk about that enough, is the mental health side of, the Corona pandemic and stuff like that. But, I'm excited that you're here today and getting to be with you, because I enjoy interacting with people. So
definitely. Yeah. The pandemic, it's kind of crazy because, with having my son Mateos, a lot actually didn't change with the pandemic, other than the fact that like I wasn't able to take him grocery shopping with me as much as I wanted to. But as far as like everybody's wondering, I can't find disinfectant wipes, I can't find hand sanitizer, I can't do this. We end up staying at home a lot more often, just because Mateos has like a lot of equipment. He's got a vent, he's got a G-tube, he's got a suction machine, and we got to carry oxygen, and then his wheelchair. With having all of those things encompassing, it's a lot kind of getting in and out of the house. But you also want to make sure with having a child who's got respiratory issues or a vent that you stay clean. So unfortunately, when the pandemic really started taking its launch, which was back in like February or March of last year, we were actually in the hospital dealing with just the common variant of coronavirus. We didn't have COVID-19, but coronavirus is actually the common cold here in the United States. And we were in the hospital when it was happening. And so when we got out of the hospital, it was a sight to see because like when we went in, the hospital was busy. When we were leaving, like staff was cut down to nil, guests were cut out altogether, and people were like, "Oh, sorry that you've been in here for for a while. You're probably gonna have a hard problem getting sanitizing wipes and hand sanitizer." I was like, "No, we keep that stock." Yeah. So nothing really changed there for us. So that's what I was saying. Like, not much really changed. The only difference that really changed for us is that we couldn't go out as often. But as far as the corona and the pandemic hitting us, it didn't really affect the way we do most of our daily things. So it was actually kind of interesting to see how when the rest of the world has been put through a pandemic, that we were already kind of like one step ahead of everybody else.
Yeah, prepared for it.
Definitely.
Got the pantry stocked with the wipes, the disinfectant. I do all the same things for my family member that I help take care of. And so we're stocked up for like months just in case, diapers and wipes and all
Plus
that.
It just helps to buy in bulk.
Yeah, especially if it's on sale.
Yeah, definitely.
Then we'll buy like a year's worth of something.
And then Costco's like your best friend.
Exactly. We go to Sam's Club. I go to Sam's Club every quarter, and I think I have to get like that roll thing, like that huge, not just a regular shopping cart, but that roll
pallet.
Yes, that's exactly right. Speaking of kind of shopping carts, you mentioned grocery shopping there. What does that look like with a son or a daughter, a child with special needs in grocery shopping?
It can be kind of difficult. One of the biggest issues I would say is that like having to push Mateos' wheelchair around with all of his equipment and stuff like that. When we did go shopping, I tried to do the whole simultaneously push a cart and the wheelchair at the same exact time, and it's not feasible, especially when you're trying to do like a full 2 weeks worth of like groceries or whatnot. So I usually try and do a lot of my bulk buying now, just being to where like I can pick it up like from the grocery store, and then they just kind of like load it into the back of my trunk. But if I'm going in just to grab a few small things, odds and ends there, I usually go in and I get a basket, and then I have what they call like one of those mommy carabiner clips that most time you'll see on the back of the people's strollers to carry purses or little bags. I use that to carry like my basket, and then I'll put all of my goods inside of the basket and push him around and kind of use his wheelchair kind of like the basket in that aspect. So that's how we mostly did our grocery shopping. And then I would do it more frequent before the coronavirus. I would go maybe 2 or 3 times a week with him, so I didn't have to do big bulk buying, and I can just do a little bit here, and also bring him along with me, so he doesn't feel like he's always stuck at home.
Does he enjoy going grocery shopping?
Loves it. Yeah, especially when we go to like Target, which is my favorite place to go to, because they really recognize special needs children. They actually have special carts at Target to kind of like for kids who need that extra little support for special needs. And I've just really got a lot of help from the staff when I've been there. A lot of them ask me, do you want me to follow you and help you get some of your groceries, which sometimes I've obliged to. Others, if I know I'm just going to grab a few things, I just put in there. But one of mine, Mateo's favorite thing to do is kind of go around the kids' clothing sections and try on hats and take on pictures and do a lot of that stuff. Yeah. He loves seeing the different lights and all the colors inside of the store. So it's really awesome.
That's amazing. My aunt enjoys getting out into the community, going in and shopping a little bit. And her favorite thing to do is at the checkout counter, grab all the candy.
Okay, because it's so grabbing.
Yeah, like the M&M's. She loves all that stuff. So she'll get a little bit of that on the checkout way. We've thought about doing kind of like the Shipt or something like that. And I'm going to acknowledge the chat here. Leslie Speakman says the BOGO is awesome, which is the buy one get one on sale kind of thing, and the bulk stuff that we've talked about. And then she also says Shipt saved us when we got the virus. The Shipt kind of services. We've been thinking about doing that. Is there a markup? Do you pay?
To my understanding, there is a little bit of a markup with like if you're using like an Instacart. I think it's max like 10%. I think it affects how far away. But what I try and do instead of having it delivered to me, so I don't have to deal with those markup of prices, is I just go and pick it up. But I do believe that Publix itself offers their own like pickup delivery option that actually they promise does not increase the cost just because you want to deliver. You do pay a delivery fee, but you don't pay, cost plus 10% or whatever it is that they add on to the goods.
They're trying to compete with the others like Shipt and what have you. I think it's well worth it, even if it's 10%, if it's $100, $10, but you don't have to, do everything else that involves going to the grocery store, even though sometimes it can be enjoyable. So I think it's worth it there. Let's talk a little bit about Mateo.
Definitely.
If you would just take us through his story.
Okay, so Mateo was born June 6, 2015, and when he was first born, we had some minor complications, but nothing that precluded that he was going to have, any kind of special disorder. Mom had group strep B, so they had to do like extra antibiotics prior to birth to make sure that he didn't, catch any kind of strep in the beginning. And then at the beginning of the birth, like before he was born, they had what's called meconium in the womb, meaning he had his first bowel movement inside instead of outside, which was kind of alarming for the doctors because, of course, you don't want him ingesting that while trying to go through birth. Yeah. And so there was a little bit of concern that he might have gotten something bacterial. So he spent an extra 13 days in the hospital and was treated with some high antibiotics. But not really treating anything that was like showing signs of like, all right, he needs this antibiotics because he's, white blood cell counts were down or elevated or whatever some case. It was just all more preventative. The only thing that really kind of extended our stay is that he was a little bit more jaundice than usual in the beginning. And they diagnosed him in the very beginning with what they call laryngomalacia. Laryngomalacia is softness of the larynx, meaning that there's kind of like, it's not as strong as others. And they, doctors were kind of like, I'm saying, this is one of the loudest cases of laryngomalacia I've ever seen, but 95% of kids end up growing out of it, so I wouldn't worry about it. So even from the beginning when he was born, we didn't really hear him cry. He made like cry face, and because of laryngomalacia, it kind of closed down on that airway a little bit. Yeah. But he never desatted, and they had him on the monitor the whole entire time while he was there. So that was kind of like what the beginning of the birth was like. And then over the course of the next like 3 months, shortly after Mateo received his first rounds of vaccines, and I'm just using it as a timeline, not stating that it was the reason why, but shortly after he had his vaccines, he started having these spasmodic type episodes. And so when we took him into for his 3-month checkup and was mentioning that to his doctors, they were like, I wouldn't worry about it. I'm more worried about his moral reflex, or I wouldn't worry about it. It's most likely moral reflex. I'm more worried about his weight gain. And we were like, okay, well, there she was like, try and up his feeds up a little bit more and then come back and we'll do a 4-month follow-up, which is they usually don't do a 4-month follow-up, but they were just kind of, overlooking his weight gain issue. And then at that point, when we were getting ready to go back in at that 4-month check mark, as we started noticing that Mateo was having issues swallowing. Mm-hmm. And so we went into that 4-month checkup and was like, Mateo's not taking in all of his formula. He's sometimes like just throwing it up or just spitting it back out. She was like, okay, well, and I was like, and he's still having these spasm type thing. And she says, the doctor was like, with everything kind of going on, his weight gain issue, I wouldn't be surprised if he's just a little delayed, so I really wouldn't worry about it. It probably just delayed more reflexes, but I am concerned about his weight gain, and you guys mentioning that he's spitting up a lot more than often. Let's go see a GI doctor. Yeah. And so that was another month down the road, and as that month went on, these spastic episodes were getting more frequent, and we didn't know exactly what we're doing. We were just, trusting that, they were telling us that it's delayed more reflex. And then when we went in for that GI doctor's appointment, that very first one at 4 months, he started having one of those spastic episodes. And I went and grabbed the doctor, and who was Dr. Gold at that time. And I was like, hey, can you please tell me what this is? The doctor, our pediatrician in his wellness office, twice as just being moral reflexes. And I feel like it's more. And he comes in there, he's like, no, your son's having seizures. He's having infantile spasms. We need to get him to the hospital. And unfortunately for us at that point in time, the GI doctor's office was directly across from Children's Hospital of Atlanta at that point in time. We went over there and his saturation was at 87%. He was still having this spastic episode. This was all in a matter of 35-40 minutes. And the spasms that he was having were like spasms. They'd last for like a second and then they'd stop. And then his body would tense up again. And so he was diagnosed with having infantile spasms, pretty much like right in the spot as soon as we got into there.
I'd like to ask, so you went, you went to the doctor, voiced your concerns, and they're like, yeah, it's not that big a deal. I think we should focus on this other stuff here. Mm-hmm. But did you have a feeling deep down that it should be approached? I love what you did to the doctor, come and see this. You need to see this firsthand. Mm-hmm. But take me through that month where like the doctors are reassuring you, but yeah, we'll do another checkup. What were you feeling at that point?
at that point in time, I was just praying that the doctors were right. Honestly, I'm like, all right, the pediatrician herself had never been able to see him, and we never thought to capture them on recording, which is one of my biggest regrets, I feel like, as a parent, is that, like, when they were happening, I should have pulled out my phone and recorded this. But what happened was that I would just comfort him, or his mom would just sit there and comfort him when those were happening, and we're like, it's, it's okay, the doctor said it's fine, and we're just trying to reassure ourselves based on what the doctors did. And that's one of the big things, because as I've done my research now, the earlier that infantile spasm is caught, the better, and the better chances of him not having a regression. And I think that from that 3-month mark to pretty much, which was like a month and a half period of time, I wish that I had taken my son into the emergency room or gotten a second evaluation, instead of just trusting in a single doctor's word. So I always recommend going forth for anybody who's out there who ends up having a kid or anything. If you have concerns about something, always go and see about getting a second opinion. A second opinion is more valuable than you just trusting a single person, especially if you know in your gut that you don't feel that it's right. I just was really hoping that, that the doctor, what she was saying was true, but we have to keep in mind that what doctors do, it's a practice. Every single doctor knows what they do. It's a practice of medicine. So sometimes getting a second evaluation is more important than just trusting that everything is okay in the end.
I applaud you for speaking up to the doctors. I think a lot of people, even with their own selves, their own body, and may feel some type of way, but not express it or not make a doctor's appointment. But for you to be like, hey, you need to see this. We need some answers here. Mm-hmm. I think speaks volumes on your character there. That confidence there.
Thank you. And so we got ourselves in there to Children's Hospital that day, and that day we ended up spending a total of a little over 30 days in the hospital. And with him being diagnosed with infantile spasms and also having laryngomalacia, they ended up doing what they call a supraglottoplasty surgery, and which is essentially because of the softness of the larynx and him being positional, it created kind of like granulation in the airway. And so when they went down there with the bronchial scope to look and see, they had to cauterize away those granulations. The granulations is kind of like hard mass tissues, and that's because he would, when we would sit him in a position with the laryngomalacia, when he would breathe, sometimes it would just be loud breathing. It's kind of like you would like somebody snoring almost, but he'd be awake. And so we would position him so before all of this was happening to where he wasn't always making that noise, and in doing so it created hard spots or granulation in that. And so they did the supraglottoplasty, and because of him not swallowing appropriately, they also did what they call a Nissen fundoplication, which is to keep him from being able to have any kind of stomach acid or food come back up through his airway and possibly get into his airway, and then also doing giving him a G tube. So they did the NJ tube first, and then after about a week or two, they realized after doing the bronchial scope that his vocal cords weren't working properly, only at 70% to 80% efficiency, and that's what made them do the Nissen fundoplication, because if his vocal cords can't close, then if anything comes up, then it can possibly cause him to have aspiration pneumonia. So they did all of these operations in a matter of 30 days, and that's kind of like what our first 4 or 5 months looked like. And then after that, it was just more treating the infantile spasms, because the infantile spasm was what was really causing the further regression. And within 3 months, all the way up to, or within technically 4 months when we first was diagnosed with having infantile spasms, all the way to a year and a half later, the seizures themselves caused him to lose roughly about 15% of both gray and white matter in his brain. Mm-hmm. Most of it surrounding around the cerebral cortex, which pretty much lost most, if not all, of his motor cortex skills in the sense of voluntary output. So Mateo is what they diagnose as a spastic quadriplegic, meaning he can only move in the sense of reflexes, and then getting him to want to move intentionally or grab things or do things on his own takes a lot of strength for him to be able to do. But we're actually making a lot of progress now that he's in school and going to Lyndon Nolan.
That's awesome. And when you're going through that, there's a few things. One of the questions I'll ask is, the seizures there, you said it kind of cut off like 10 to 15% of the gray matter there. Is that because of lack of oxygen to the brain? Is that how that?
That's actually a really good question. That's the same question that I ended up asking the neurologist, but they were like, no, because signs of hypoxia is what you're talking about, lack of oxygen to the brain, starts from the outside in, and the problem was surrounding his motor cortex, or his what they call the basal ganglia. It was going from inside out. So it's definitely some kind of genetic disorder and nothing to do with oxygen deprivation at that point. So we were concerned about, I was concerned about that too. And they were like, no, if it was signs of hypoxia, you would have seen from the outside work its way in, because the blood cuts off circulation from the out before it
that
starts
makes
in
sense.
the central.
Yeah. And the other thing, when you're going through this amazing story in your guys' journey, is I pick up on a lot of medical terms.
Yeah.
I'm blown away. I don't know half of what you just said in the medical, but kind of take us through that and how you had to go through that and learn these things, because I imagine the doctors are saying the exact same thing and all this medical jargon. And then I would just want to get on my phone or my computer and say, what the heck is that?
That's exactly what I did. When anytime a doctor had brought up a new medical terminology, one thing I want to tell you guys is that there's no such thing as a stupid question, especially when you're dealing with your doctors. It's their job to educate you. It's their job to be there for you and help you understand what's going on. So most of mine was just asking doctors. And there were times where I could tell that the doctors were kind of upset, because I would literally keep them in my room for 35, 45 minutes asking questions. But that's your job as a parent. That's your right as a parent, is to ask those questions and find out. So I tried to get my information mostly from what I would say the horse's mouth or from the doctor's mouth, then just go and try and educate myself on the internet. But I did also do education on the internet itself. So try and get most of your information, if you can, from your doctors. If your doctors seem like they're in a rush or that they need to get done, unless you're in the PICU floor and it's emergency and they're like, I've got this patient that's coding right now, keep them there. Ask those questions. There's nothing wrong with that. They can get upset all they want, but it's your right as a parent to know what's going on. So, and that's where I learned most of my stuff. When they told me what's learning militia, I had them break down, like, what does that mean? And then they're like, softness of the learning. And I was like, all right, what does that mean for his future? And they were like, well, most kids end up growing out of it. But I was like, but Mateos obviously at this point, not most kids. So what does that mean? And we found out early on that he may possibly end up needing a trach. And then Mateo didn't end up actually getting his trach placed in until he was about 2 years old, a little 2.5 years old is when his trach finally gave him, because in the beginning when they told us we should put him on a trach, I was like, nah, oxygen's working for us right now. The thought of having his trach, having to add on another medical complexity on from a parent standpoint, we were like trying our hardest to hoping that he would gain that strength to be able to do it on his own, because like the doctor said, 95% of them end up growing out of it. But in his particular instance, after 2 years, it wasn't showing any kind of improvement in the strength in the airway, and he ended up having to have an emergency tracheostomy.
I like that I like how you went through that. It's like giving him the opportunity and a chance to do it on his own, giving him the opportunity to grow there. And that's okay if it doesn't take, then you can always go back. But it's almost like you want to give him the opportunity and his body to try and make that and not hinder that progress. And and then you made the decision at 2.5 that it was something that needed to be done.
Definitely. And honestly, it was scary in the beginning when they mentioned it to us, and they were like, oh, so you're going to have to do trach care, you're going to have to do this, you're going to have to do that. But once you do it, and like even the doctors, and then that's one thing that was great about when he had it, they were like, once you do it, it sounds like a lot, but it'll be so much more easier for you you'll rest easier. It'll just be so much more easier for you. And when we finally made that step and he had that tracheostomy, that learning curve was a huge learning curve, but now it's like second nature to us, being able to just change it. I can change a trach out by myself. I don't need any hands on, and I can rest peacefully at night knowing that, did I lay him positionally right? And that was the biggest problem before the trach. It's like, all right, did I lay him down right? Like, I can hear, is that him snoring, or is that his laryngomalacia acting up? Is he comfortable? Is he getting the right amount of oxygen or not? Because in the beginning, when all this happened, went home, we didn't go home with a pulse ox. It wasn't until his second or third hospital admission that they finally gave us a pulse ox, to where we can see those numbers. And even then, we'd wake up in the middle of the night, because he was able to move at this point in time. And sometimes he'd move and kind of roll a little bit, and they would change that positioning. Having a trach, we didn't have to worry about that nowhere near as much. So.
Yeah, I imagine that's one less thing to think about is very nice. I'm going to acknowledge chat here. There's a few comments for questions here. Leslie Speakman says, my daughter was having myoclonic seizures, and I had no idea you could have seizures without completely falling out.
Yeah.
She was having trouble in elementary school. And then Mr. Lorenzo Brown asks, what school does Mateo attend?
So currently, Mateo attends Linda Nola Learning Center, which is based in Shelby County. And they have been wonderful so far. We've got an IEP in place and plan. And this is something I want to let everybody know too as well. Prior to Mateo coming to Alabama and going to Linda Nolan School, I know my son in and out. I can read his, the way that me and Mateo communicate, or the way that Mateo communicates is through his numbers, through his pulse ox machine, or through his ventilator, reading his numbers, reading those stats, also reading his skin, his skin tone color, and then also facial expression. Mateo is able to kind of communicate a little bit through facial expression, but he's nonverbal, and then through also just kind of, just like listening to him. He'll do this thing that when he's kind of like in pain, he'll kind of like purse his lips and his tongue and then blow bubbles, and that's like kind of signs of me letting him know that he wants to be repositioned, kind of thing. It wasn't until he started going to Linda Nolan that I realized how much my son actually is able to communicate, because I'd never had anybody show me ways to truly communicate. So I communicated to my son and I let him know, like, hey, I love you. I'm here. We watch cartoons together. We'll sit there, and his favorite thing is Paw Patrol. His room is decked out with Paw Patrol stuff. So Paw Patrol stickers, Paw Patrol blanket, Paw Patrol sitting chair. It's decked out. So it wasn't until he started going to Linda Nolan that I was able to understand that he can do yes and no questions by blinking his eyes. So asking me, hey, like you should see this picture that he made the other day with his teachers. They made some snowmen, and he told them that he wanted to make 3 snowmen. And that he wanted to have one of them upside down, and that he wanted 5 snowflakes on there because he had just recently had turned 5. He was like 5.5 years old. And I'm finding out that there's ways that my son can communicate. So I owe a lot to Linda Nolan Learning Center for being able to do that. And then to address, I believe who it was with the myoclonic seizures. There's a lot of unknown stuff about seizures. Mateo suffers from 4 different types of seizures. So he still has the spasms, but they don't have hypsarrhythmia, which is an EEG pattern behind it, which means that he's not going to have any further degeneration in his brains because of it. So he has those. He has tonic-clonic, myoclonic, and I can't remember the other one. There's another one that he has. But he has what they call refractory epilepsy, which is when he has these type of seizures. I can't remember the name of them right now. I apologize. They can last anywhere from 30 minutes up to an hour and a half. The longest that he's ever had is a 3-hour seizure. Really? Yeah. So,
now, is he taking medication for seizures?
Yes.
And he's still having seizures?
Mm-hmm. And the seizures are, for the most part, all under control. The only thing that most of the time that ends up throwing him for a loop, and it's nothing that we can control, is the weather. Like, for instance, when that tornado came in the other day, Mateo went like a week and a half without having a seizure. And then, like, that night, before the rain came in, before the storm came in, before anything, he had a seizure. And then 4 or 5 hours later, that tornado came in, and just 45 minutes north of us. And it's crazy. So the weather pattern changes a lot. When it changes a lot, the barometric pressure changes a lot. He's more prone to having seizures. And then the spasms, we've got them under control as best as they possibly can right now. We're on Epidiolex. We're on which is the legal CBD through Medicaid. We are on Topamax. We are on Tegretol, and we are on phenobarbital, and for the most part, they maintain all of his seizures really, really well for right now. So
I want to ask a few questions about the school and kind of that process, and we're getting quite a bit of comments in chat. Sharon Glenn Henderson says, parents become medical professionals the hard way.
And this is true, and this is actually one of the reasons why I applied for my FAFSA last year, and I'm hoping to go ahead and get myself started to become a registered nurse. It only does much more better for him, allows me to understand and to be able to better care for him and be able to help other parents out for just to reassure them that my goal one day is to be able to work into a hospital, possibly even the pediatrics, and let them know, hey, if you don't understand something, ask questions. I want to make sure that everybody understands. If they're ever placed in a position like that, ask questions. I can't stress that. I mean, I get emotional just thinking about it. Just ask questions, man, because I felt like I didn't ask enough in the beginning. And then once things kind of got the ball rolling again, once he finally got into the hospital, that's when I didn't let the questions stop, And I felt like in the beginning, when I asked the doctor about the whole spasms thing, I asked her, hey, he's having these spasms, what do you think they are? And she was like, I stopped. Because she said it was this, and I didn't follow up with questions. So ask questions. I want to be there to let parents know that they have that right.
Well, speaking with you today, I imagine that you put your foot down and stood up. And
definitely.
And we support, that journey that you're thinking about with the RN. I think that's amazing.
Thank you.
That's life-changing, and to be able to be with parents that are in that position and, almost give back and as a duty and have that be part of your job is amazing.
Thank you. I appreciate it.
So the becoming professionals the hard way. Leslie Speakman says that's so true. She also asks, will they get him a communication device to use with his eyes?
Possibly. Now we have to get more consistent with him and him being able to communicate his eyes. He has what they call right now about a 7 or 8 second delay in regards to response time sometimes. It takes him a really while to understand, kind of like what's going on. But that is our goal, is to be able to get him some kind of device that allows him to communicate with his eyes because he's unable to do it mobily.
Yeah, that would be pretty cool. And technology's, crazy nowadays. I know even on Twitch they have an extension where you can do like a heat map of where the streamer's looking on their screen.
Oh, I've seen that kind of stuff. I've seen those little videos that have popped up and stuff. That's kind of cool. Like that is my ideal choice for Mateos, for him to be able to communicate and to be able to give him an actual voice. That's my goal. So.
Let me read through a few more of these comments here. Lorenzo says you're a pretty awesome dad.
Thank you. I appreciate it, Lorenzo.
Vera Lewis Spink says, my son Zan was finally diagnosed with LM over the age of 1 year. I had to fight for that diagnosis. They kept saying it was reflux, but I knew it wasn't. Before he was diagnosed, just 1 second here. Before he was diagnosed, they found, I'm going to butcher these words, I'm sorry, Mrs. Spinks, Pseudomonas growing in his lungs, and then the Aero digestive team diagnosed the moderate severe LM that would never correct. He had his surgery to correct his airway and finally was able to eat again without thickening. So many doctors don't know about the LM.
They don't.
But my daughter with complex medical diagnosis taught me to trust my gut. So thankful you got your answers for your son. And she says my son is now 6 years old.
That's awesome. Yeah. It's so weird because, like the doctors were saying to us in the beginning when he had laryngeal, 95% of children who have laryngomalacia grow out of it. It's 95% of them. But to me, to have 5% of the population that's born not to make sure that it's addressed by an ENT at birth, just to rule it out, I think is something that needs to be evaluated by the entire doctors. Even if you know for a fact that 95% of children grow out of it, I think doctors need to start taking it more seriously. Because it can be pre-signs towards other genetic disorders. So I think I'm so happy that you finally got a diagnosis on that at a year, and that you're able to start being able to eat by mouth again without thickening. That is absolutely amazing, and that's one of the things I just wish that doctors would see is that hey, when diagnosed, I don't care if 95% of kids get, at least tell them to follow up with the ENT. Within the first month or however, just to rule out the possibility.
Yeah. So. And we've got a few more here. Vera Lewis says, you can do it. You will be a great RN and family patient advocate.
Thank you so much.
And Sherry Glenn Henderson says, we need him as a parent consultant.
I would definitely do that. If anything, if y'all ever, and feel free to reach out to me if you ever feel like you can't be a voice or that you don't have that courage to do it, and you want somebody to step in and you just want to talk to somebody about your problems or what's going on, and maybe even I would literally volunteer my time to do that. I've had doctors I've had nurses come back to me and tell me like, hey, doctor didn't look like he was liking that you asked a lot of questions, but I'm glad you did it.
Yeah.
So I would be that voice for any parent, letting them know that, it's okay. Definitely.
Well, the community is definitely behind you.
Awesome. Thank you all so much. I really appreciate it.
I have two questions here. You mentioned that you really push for getting a different diagnosis from a team of doctors. What does that look like here in Alabama? Is there a good Children's of Alabama? What does that look like for a team of doctors for a young child?
Okay. Now, Children's of Alabama, they're currently, there's no release or time for it, but they are currently in the talks of developing a medically complex care team. When we were in Atlanta, we had a medically complex care team, which was absolutely amazing. It was a trial program in the beginning. That Mateos was able to be a part of, first of the 75 patients to ever be on it. And what that did for us in Atlanta was allow us to combine all of our doctor's visits, or most of our doctor's visits, into a single day. So we didn't spend most of our time going back and forth to, we were last month. Last month in December alone, we had 7 doctor's visits. Now, fortunately for us, they don't have a medically complex program here in Alabama yet that coordinates, but the doctors are understanding, not even just with my son Mateo, but with other parents who have multiple doctors and specialties, that they're trying to coordinate to where they're all on the same exact day. So like last month, I think on one day I had 4 different doctor's appointments. So when I say appointments, 2 of them were actually labs as well. And then 3 doctor's appointments in a single day, all at one location. And that's what it looked like in Georgia. But they also had like what they called a medically complex care card. So whenever I called 911, if anybody's ever had to call 911 for their special need or a significant other, and they always ask, what's going on? You feel like you have to give them a whole entire rundown. This is this. They ask what's like baseline. They ask who your doctors are. And like at that point in time, you're like, you're in an ambulance on the way to the hospital, and you just want to make sure that you're looking at your kids and to make sure that everything's kind of okay. In Georgia, what they did is they gave us a card, and we call 911, we just hand it to them. It says, if you have any questions, that's not on that card, then ask me. But yeah, right now, I'm just overseeing my son, and y'all getting him to the hospital right now. And it literally saved us a lot of time. We would get into the hospital, the general urgent cares or the emergency care doctor that was on staff would get that card, and then if they had any questions, on there with the doctor's names and the numbers that were on there. So a lot of times they would just reach out to those doctors, and before even coming back to us and not bothering us, because we get tired. We're in an emergency room right now. We're wanting answers. We're not wanting to be questioned to the 10th degree. And so that's what Alabama is currently working on. They're in talks and developing right now. That's not in works right now, but they are in talks of developing it right now. They're working on creating a transition program for children who are 18 years or older, transitioning into an adult hospital away from Children's Hospital. But Children's of Alabama is working on it, and I'm actually going to be helping them back and grow that. I've had them coordinate already back and forth with the Atlanta complex care team, and so they're taking notes and they're taking information right now to go ahead and start getting that into the works.
That complex care idea and being able to concentrate all of those doctor's appointments on specific days has got to be huge, because just the time and effort, of traveling. I don't like going downtown Birmingham, but if I could knock all that stuff out in one day, that would be, awesome. And I'm excited to hear that Alabama is working with you and taking input to build that here, because I feel like that's something that can really benefit families.
Definitely. We would have our pulmonology visits, our neurology visits, our dietitian visits, and our respiratory tech visits. That's taking care of like the vent settings and everything like that. And we'd all go to one, and we'd only spend like an hour and a half to 2 hours there most. The difference between what was happening in Atlanta is that, that one doctor's appointment would take 2 hours. Here, if I schedule 3 appointments in a single day, I'll be gone for 6 hours. Yeah. And that's just because they're not coordinated to work together. So I have to go from the 11th floor to the 6th floor to the 1st floor to do everything. And because they don't work in a time constraint, and look at it as a single doctor visit, one doctor's visit might be an hour and 10 minutes, and one of them might be an hour, and another one be 45 minutes, but then they'll have you wait 30 minutes in between each doctor's appointment.
Yeah.
So
it's tough. You got to work with a few different schedules there, but you'd like to say like, hey, we're just going to be in this room. You guys come here.
Exactly.
And we'll be here for a few hours. Let's just get this knocked out.
Mm-hmm. They actually they now have a whole entire building in Atlanta now that coordinates, and a floor that coordinates that complex care team. So when anybody who has those kind of complexities they stay on that floor, and then when they go in a room, all those doctors and nurses will come into that one room.
That's the way to do it.
So that's what we're hoping to get started here in Alabama.
Mm-hmm. That's amazing. I'm gonna acknowledge chat here.
Mm-hmm.
Sherry Glenn Henderson says we need him as a parent consultant. I said that. Leslie Speakman says the hardest part is to get medical professionals to listen. I've gotten into an argument with her neurologist about her medication that works for her. Mm-hmm. So it can be kind of tough push and pull there, where the doctor's like, we think this should happen, and you're like, I'm at home and I see that it's not working. So getting that to him. You kind of touched on that, with the videos at a young age, making sure you record things. So it's not just like, hey, I think this is what's happening, but here I can show you exactly what's happening, and documenting that can go pretty far in speaking with your doctors.
Definitely. And that is true. Just because you can get a doctor to come in there and you keep them, asking them a bunch of questions, doesn't mean that they're sometimes necessarily listening to you. And that's why I say it's very important that you also, if you have those kinds of concerns, address them with your patient care coordinator. There's one in every hospital to kind of take care of that. Something similar to happened to us last time, or not last time, but it was one of the past visits that we had last year when Mateos was admitted to the hospital. We were admitted to the hospital because he was having prolonged seizures, and his current seizure plan at that point in time caused him to, when I had to use the max dosage to try and get the seizure stopped, and it still wouldn't stop, we got admitted to the hospital. As soon as we got admitted to the hospital, they took us up to the pulmonology floor, quarterback 10, and he became hypothermic because of the medication that he was using, the amount of medication that we had to use, which was our actual, our plan that was given to us by our neurologist. And they just could not keep him onto the pulmonology floor, which is, I got to give the people in quarterback 10 credit. They are amazing people there. We ended up going over to the PICU floor. So we went to the PICU floor, and granted, the PICU floor always there was a lot more stuff. There was this one time that I had an issue not only with just the nurse, but it was the doctors that was on hand. Mateo has a seizure plan that's put in place, but when he's in the hospital, it's slightly different. And the only thing different about it is that when he's in the hospital, they give it to him intravenously, the same medications intravenously versus gastro, which is through his G-tube. And, so he started having a seizure. I pressed the call button and let them know he's having a seizure. And they come in there and they're like, so what's his seizure plan? And I'm like, we're at the hospital. It's in the computer.
Yeah, what's the seizure plan?
Give him Ativan. That's the seizure plan. Give him Ativan and give him phenytoin. And they were like, okay, well, like how much? And then they start asking me all these questions, and I'm like, well, y'all should already have like his seizure plan and seizure medicines upstairs, like ready in the Pyxis machine or whatever it's called. To have it on ready. So now I'm giving it to them, telling them what to do. And so the nurse comes in, she gives him the Ativan through the intravenously, and then she leaves the empty syringe attached to his IV thing.
You gotta be kidding
So
me.
I'm like, I'm sitting there watching her, and that happens. 10 minutes goes by, and I finally take it off, and I put, and she's in the room. I take it off and I hand it to her. And I'm like, you left this here. I don't want you to get in trouble. Here, take this out, because like y'all supposed to dispose of those right away. Even though it's empty, you're still supposed to dispose of them. And so she was like, I'd appreciate if you don't touch our medical stuff, our medical things again, or whatever. Some case. I was like, I just didn't want you to get in trouble. I was just giving that back to you. You shouldn't leave that in there, kind of thing. And I was like, but he's still seizing, so he needs another milligram of Ativan. And she's like, well, let me go see if that's true. And I was like, first you asked me what his plan is, and so then it took them 20 more minutes to finally get a doctor. The doctor finally came up there, and he was like, so what's going on? I'm like, he's seizing, and you have already given him one dose. It hasn't stopped yet. We need to give him another. And that's what his seizure plan is into the computer. And he was like, okay, well, go ahead and gave the nurse permission to go ahead and give him an Ativan. And the nurse was like, well, it doesn't say in the computer whether or not we're supposed to give it intravenously or gastro. I was like, it ended up being a long story. Needless to say, me and the nurse ended up going at it, ended up getting into an argument. And then I got upset at the doctor because after he told him told the nurse to go ahead and give the Ativan. He walked away and didn't confirm intravenously or not. And so we had to call the RN on staff who was able to override the Pyxis and give it to him intravenously. And it was a whole, and at the end of the day, the patient care coordinator came upstairs. Actually, a social worker came upstairs and was just telling me, reminding me of what my place was in the hospital, not touch medical equipment or do stuff with medical equipment. And I was like, well, she didn't remove the syringe again the second time when she gave it to intravenously. So that came in. And so I finally went downstairs to the patient care coordinator and I was like, I do not like the nurse's attitude. I want a different nurse from Mateo's room. I said, and I don't like the doctor that was on call at that point in time because, granted, I know PICU4 is very busy. He didn't give proper instructions to the nurses in regards to either give it intravenously or through gastro. My experience on the PICU4 this time around was not great, and I want my voice to be heard. And so I went down and talked to that patient care coordinator, and lo and behold, I got an apology from the doctors, from both the doctor that was on call and the nurse that was on call in regards to it. Because at the end of the day, there's only so many ticks that they can get on their record before they can get in some serious trouble. So if you ever have a problem with your doctor or with a nurse, go downstairs and talk to the patient care coordinator because they will make sure that those doctors come back to you or nurses will come back to you and talk to you in an appropriate manner and make sure that your voice is actually heard.
Thank you for sharing that story. And just, standing your ground makes a huge difference. And it shows, your family, your son, of advocacy. Mm-hmm. And that's okay to stand your ground and speak for what you need and what you want. So you doing that shows other people they can do that. So thank you for leading that and being that.
Definitely.
A few comments in chat here. Vera Spink says, Sharon, yes, we do. This is in reference to the parent advocate. Mm-hmm. Maria Gutierrez says, yes, I agree. She also says he needs to be hired by a state agency. What great asset he would be.
That would be awesome.
And Sharon Glenn Henderson says, yes. Leslie Speakman says, most doctors and teachers don't know about vocational rehabilitation. That's what helped us when they had a whole team with nutritionists and neurologists. It's a half a day stay though. Vera Lewis Spink says, would you be willing to share your complex care team experience with our children with Complexity Project we are working to build here in Alabama? It's housed out of the USA in Mobile, mm-hmm. in hopes going statewide. Let's chat. I am one of the parent representatives on the team with Sharon, who is watching now. There are also members of Children's out of Birmingham on the team too. So I'll go ahead and get you guys connected after the broadcast.
Perfect.
And share that information there. And Sharon Glenn Henderson says, we have plenty of openings at CRS, Children's Rehabilitation Services.
Awesome.
And Vera says, yes, Alex will share the contact info. And Sharon Glenn Henderson says, guys, I'm sorry, I'm reading through this chat. You got to give me a second. Sharon Glenn Henderson says, are you in Birmingham?
I am north of Birmingham. I'm in Shelby County, Calera, so I'm about 35 minutes north of Birmingham.
Yep. And so Leslie Speakman says, I think he's in Shelby County. That's close enough. Mm-hmm. He's got my vote for Dad of the Decade.
Thank you so much, y'all. Thank you so much. I mean, having y'all support means the world, and I want to let you guys know that y'all have my support too as well. So if there's anything that I can do, if there's any kind of information that I can share, if there's anybody that I can reach out to and be an advocate for at any point in time, please let me know, because nothing's more important than having your voice heard. And that is the biggest thing, especially for, disabled people and children who can't speak for themselves. Mm. So that's the biggest thing.
Yeah. Sarah Williams says, hey, Antwain. Sherry Glenn Henderson says, hi to Sarah, and back and forth. Leslie Speakman says, a lot of parents have to do that, and it's tiring and frustrating. So I think a lot of people are agreeing with some of the struggles that you've been talking about here. Mm-hmm. Go ahead.
I was going to say one other thing too as well. I want to give, I'm not sure if she's watching this broadcast or not, but I want to give my son's nurse a huge shout out. We do have nursing care through the state of Alabama. She gives us, I get about 57 hours or 56 hours a week through there. She is absolutely amazing. And I want to let you guys know that if you have a child with medically complex needs, to the points where they need a lot of medical equipment, you are eligible to have nursing care at at home. I was told in the beginning when I first moved here to Alabama, good luck getting nursing care. And you can only have one or the other. And by one or the other is that they told us we can get respite care, which is respite care is like considered skilled. You can have skilled and unskilled nursing at 15 hours a week. That max they had told me. But I went through the agency Sunbridge, is who Mateos home health nurses through, and who our respite care is actually through. And we got qualified by both only being on Medicaid. So that is very important. The difference is that like the E&D waiver, which sponsors the respite care, is who handles the respite care. But Sunbridge themselves has the ability to be able to bill Medicaid and for just nursing care. So you don't need to be on the E&D waiver program in order to get home health nursing care. There may be a wait for it, but fortunately for us, the same day that I ended up getting respite care, within a week, it was approved through Medicaid, and the following week, I had a nurse in my home. Now, this is the second nurse that I've had since I've been here, but she's been on with Mateo now for the past year, and she is what's allowing me to be here with you guys today and speak and talk. And allow me to do all these other things. So I'm really glad to get this position to be able to come and talk to y'all, because one of the biggest things I want to be able to do is get out and reach and meet other people with families with special needs, because I don't get a chance to get out much. And when I do get a chance to get out, most of the time it's just going to the grocery store and back. I'm not sure if my title's showing up on the screen right now, but I'm a single father, I'm a gamer, and I'm a streamer. And so if that doesn't say anything, it pretty much just says I stay at home all day. So I hope to get a chance to meet everybody, or meet as many people as I can, to speak to many people I can, because I want to get connected. I want to be around other people who have, like the similarities or struggles with some of the same problems. It gets lonely being a single parent and having nobody to be able to relate to. So that's what I'm hoping to do for everyone here, is be able to relate and be a friend to everybody.
I think everybody's got very open arms right now watching. And for everybody watching, Antwain and I have been speaking for a couple weeks now.
Definitely.
Back and forth. And Antwain's going to be coming on and doing his own broadcast. And we're planning on about once a week right now on various topics. So if you guys want to talk about a specific topic, please put it in the chat. It'll give us some good ideas to come up with some content. But you'll be seeing Antwain more on screen here in the future. So I'm excited about it. This is the first time we've met.
Yes.
It's going to be awesome. So
I'm excited.
It sounds like everybody's trying to pull you away to go work on other things. And I'm like,
well, I want to get started with this. I want to get connected with everybody first. And through this platform. Because I feel like I can reach a lot more people this way. I do want to be able to have something that's definitely more full-time, just because it's been a struggle being able to work. This past year, I've had a really hard time trying to work from home, so we've been just kind of living off of Mateos SSI and just getting assistance from the state. I'm trying to move away from that, because before I got full custody of Mateo, I've been 100% independent working in the IT field, and I've had to make certain sacrifices, which is being able to work, but those sacrifices, I keep reminding myself, are meant to take care of him. And and I'm just glad to kind of get out of that now, because I feel like I've got a really good home health nurse that I can trust leaving alone for long periods of time with my son, to be there to be able to do that. But most definitely, I want to help as best as I can to everybody. So please add me on Facebook. My name on there is Antwain M. Jordan. Look me up on there or send me a message. And I think that with me working with you, Alex, I'll probably be getting Alabama Care email. So once I get that email set up, I'll send that to you guys so I can have, if in case I miss something, I can at least go to my inbox and catch that information.
Yep.
But yeah, it's great. I'm loving being able to connect and actually talk about this, and having my voice heard as a parent, and understanding that there's others who are struggling, but we don't have to anymore. So
I like the way that you put that. You don't have to anymore, and we're all in this together.
We are,
and there's strength in that community. You mentioned something there about trusting the nurse and being able to spend time away. I was thinking about that when you mentioned the school that your son goes to, and what was that kind of like, of kind of letting him out of your sight?
He hasn't yet, actually. So Mateo's in school, and because of COVID and everything that's going on, we're homebound right now. So so his school comes to us well, right now for only once a week. That's on Wednesdays. We get PT and OT in the morning, and in the evening we have vision and special needs teacher. And the evening is with Miss Michaud, who's his special needs teacher. She is one who's been really doing an amazing job with him and showing us as a family that he can communicate by use of his eyes. So we try and ask yes/no questions like, hey, do you want 5 snowflakes or 4 snowflakes? How many snowflakes do you want? Kind of things like that. Do you want him this way? And when this is done, I'll post the picture to Alabama Care. But you got to see this drawing that he's got. He's got 2 snowmen on the outside that are facing up, and one that's like upside down, because we asked him questions. Do you want him facing this way? Yes or no? And he blinks with his eyes, once for yes, twice for no. So right now, as far as education goes, we are homebound. And when the coronavirus passes and everything like that, and he is able to go to school, I'm already working with Lenola to be able to have his home health nurse there at school with him for the first few weeks, because this type of seizures that Mateo has are very unique. I mean, where everybody's seizures, they're unique in its own. But if you don't know what you're looking for, you can miss for 30 minutes or an hour. Yeah, he's seizing. Sometimes it's just the tip of his tongue, and you just see this rhythm change. And then if you don't catch it fast enough, it'll start to spread. And the next thing you know, it's his face, and then his left arm, and then his right arm. It never gets to the lower trunk of his body. But I need somebody. I won't be able to let Mateo out of my eyesight, even going to school, without somebody else being able to understand and know what to look for. Else I have to be in school with him, because sometimes it's just the inner part of his left eye. Yeah. Sometimes it's just the tip of his tongue. Sometimes it's the wrist, it's the elbow. And if you don't know what you're looking for, you'll never see that he's having a seizure, because his seizures aren't like everybody's seizures. Just like I think it was Lorraine we had mentioned earlier, had the myoclonic seizures.
Yes.
Sometimes people don't know what to look for, and I can't trust that just yet, letting Mateo out of my eyesight. And it's been, I think, since I've had Mateo's nurse, we have, I have gone out to have like a night to myself twice.
Yeah.
In the past, since we started March of last year with her. So I don't get out often now. When I go to Georgia, which is where Mateo's mom stays, and he spends time with his mom, of course I do get my time then when she stays with him, but she's the only other person that is allowed to watch my son for any length of period of time to be able to allow me to have those kinds of breaks. Yeah. So,
it's awesome that you have a nurse that's been with your son for a year, and it takes time to build that relationship. And my family member has been very fortunate that she's had a few people with her for 7 years, 15 years, and it takes time to build that trust. But when you have it, it's very nice as part of the team.
It definitely is.
There's a lot of people in here, saying they want you to start working as a parent consultant, full-time CRS. Is there an ask that you have for the community on something like, a question that you have, or something that we as a community could help you with? I know you're recently new to Alabama, maybe housing or anything like that, or...
Definitely. Actually, I'm glad that you brought that up, Alex. So currently with my living situation, I'm fortunate that I had a friend of mine who had 2 extra bedrooms in their home when I had to put everything behind me, as far as like my job and everything like that allowed me to stay with them rent-free for this past year, especially with COVID and everything kind of going on. But it's coming to the point to where she is about to have her kids move back into home with her. So if anybody knows of anything in regards to subsidized housing, and being able to like move, I've got like maybe an additional 2 more months at my current residence before I have to move. And if I don't find a place soon enough, I'm probably gonna have to move back to Georgia, just because that's where most of my support group is in regards to his mom, and then my family that's out there. But I'm really hoping to stay here because I have my daughter that's here, that only lives 30 minutes away from me, and I'm trying to stay in the Shelby County area. So I've been in contact with Shelby County Housing Authority, Montevallo Housing Authority, Bessemer Housing Authority, but the waiting lists are just really long.
Yeah. So
what I'm looking for is somebody who will work with me on like a sliding scale until I can actually start getting everything up and running with Alabama Broadcast, and any other future projects I may be working on, such as patient care advocacy. I would love to do that for you guys. I would even do it free just to let you guys know that your voices deserve to be heard. But right now my income is kind of restricted right now with being unable. So if anybody knows anywhere that I can look, any kind of places I can talk to in regards to that, that would be awesome. Please send me a message, email, and then I'll get a contact phone number for you guys to be able to text message as well too in the future.
Yeah, so I'm going to ask the community, guys, if you have contacts, if you have information, please step up, and contribute to Mr. Jordan's journey and his son and daughter's journey. You guys have gotten to know him a little bit here today, and I'd say he's pretty awesome.
Thank you.
So please, if you guys have any information, you can put it in the chat. Antwain will be able to go back and view all the chat. Or if it's a more likely thing, you can always email me and I'll forward it, something like that. So.
Definitely. Thank y'all so much. Honestly, just even for the support that you've already given.
I'm going to go ahead and read the chat here.
Yeah.
Got quite a bit. Verlo says, I'm going to share the information. Is he in Birmingham, Shelby County? That's close enough. Sarah was, hey, Anton, going back and forth. Leslie Speakman says, a lot of parents have to do that, and it's tiring and frustrating. He can send a friend request if you want on Facebook to connect. He's definitely a parent consultant. Sherry Glenn Anderson. Definitely want to meet you. Leslie Speakman says, we're transitioning towards adult care now. I'm so nervous. So you were kind of talking about that transition at the hospitals here. So I'm excited that there's something going on there that they're piloting.
And there's just to let Laura know as well, their patient care relations and Children's of Alabama, her name is Lori Dunaway. Her direct boss is Amato Santos. They are currently working on a transition care for children who are 18 to be able to transition into another hospital to help manage and take care of this complex. If you have any questions, I would definitely recommend reaching out to patient care relations and asking to speak with Lori. Amato is really a busy guy. He's a director, obviously, so he stays busy. So reach out for it, and she will definitely give you any kind of information that you need in regards to training. That is their current working project that they are doing right now.
Awesome. Parent consultant material, that's so exciting. Sarah Williams says, let's be exactly, my daughter was having seizures in class, and the teacher recognized something was wrong and had no idea what was going on. If it wasn't for her, there's no telling how long before we would have found out. And Leslie Speakman says that she knows a park in Shelby County, but I would suggest temporary. So we can go back through and kind of does the housing thing there.
Okay.
She put in the chat. We're kind of coming to the close of our time today, and I know there's a lot that we haven't talked about, and I always love that because that's just how a conversation goes. You don't want to be point by point there. I will say, chat, if you guys have anything that you'd like to ask Mr. Jordan here before we stop going live, please put that in now. Antwain, is there anything that you would like to say to other fathers out there?
Definitely. Being a single parent in general is hard. I'm never going to sit there and say that I thought a single mother's job or a single parent's job was easy, but it's definitely was an eye-opener for me once I became a full-time parent of my son, and then also having my daughter as well, who I have 50% custody. I get her every week from either Thursday through Sunday or Friday through Monday kind of thing. As far as for single fathers, I just want to let you know, it's never stop fighting. Never stop fighting. It takes two to create something as miraculous as a baby. And it is our duty and our responsibility to make sure that we do 1000% we can for our kids. Sometimes it's a struggle on both sides in regards to timing and working things out. But stay consistent. Stay consistent and be involved. Just stay involved. Even if the opposite party is opposing of it, just keep trying and keep records of you constantly trying. It may take a year. It may take 2 years. I had issues with my daughter's mom for the first year, but we finally come to the point now to, like, when we talk, we don't have a friendly conversation, but it's always directed about the kids. But I fought for a year just to be able to, with her on scheduling and getting things right. And we finally have a pretty decent schedule. And she did not make it easy in the beginning, but I never stopped. I mean, I literally upended my whole entire life and moved to Alabama for her. I could have stayed in Georgia with my son. Never stop fighting for your children, and that's mother and father both, not just being a single father, but for sure, definitely father's sake. So never stop fighting.
Guys, we need to give all the love and support to Antwain here. He's sharing his story. It's an incredible story.
Thank you.
And I'd like to thank you for spending the time with us and being a part of our community.
I'm glad that I finally was able to kind of get out there and finally start to meet and talk to a lot of y'all. I'm in a lot of special needs groups. A lot of people post pictures of their G-tubes and ask questions or talk about things, their stories, and I'll get on there and I'll reassure them that they're doing right or tell them this is what it looks like, but I'm not a doctor, please go see a doctor kind of thing. And now I'm glad that I can actually do that in my neck of the woods. So,
well, it's been very engaging today. And guys, I know we're going to go ahead and cut it off here, but don't worry, Antwain will be back.
I will be back
next week, and so we'll get that on the schedule, and he will be doing his own broadcast. So, guys, be sure to tune in and watch along and be in chat there.
Thank you guys so much. I really appreciate all the support, and I just want to let you guys know I'm also here for you too as well.
And at this point, we're going to go ahead and end the broadcast.